Hi, it's Christina with the Sisyphean Journal. Today's July 30th, and I already covered today's anniversary, which was a criminal abortion death that was actually adequately documented by the pro-choice people who posted it. So kudos to them. I recognize that, and I provide the link below. But I want to provide you with content every day, so we are going to get back to the Kermit Gosnell grand jury report. Now, we've already covered just a basic overview of the clinic, what he did to the babies, and we're not talking unborn babies. We're talking about born, viable infants that could have survived if you'd taken them to the hospital, and how he killed them by taking surgical scissors right there and severing their spines. We've looked at what he did to the women, and now we are going to look at how this was able to go on for so many years. Again, this is verbatim from the grand jury report. See no evil. Pennsylvania is not a third world country. There were several oversight agencies that stumbled upon and should have shut down Kermit Gosnell long ago, but none of them did, not even after Karnamaya Mungar's death. In the end, Gosnell was only caught by accident when police raided his offices to seize evidence of his illegal prescription selling. Once law enforcement agents went in, they couldn't help noticing the disgusting conditions, the dazed patients, the discarded fetuses. This is why the complete regulatory collapse that occurred here is so inexcusable. It should have taken only one look. And I think the word regulatory collapse is not the right term. I think it's regulatory capture. Regulatory capture is when an industry that the authorities are supposed to be regulating have key people from the industry in those regulatory bodies, and they are looking out for the industry in question rather than for actually enforcing the law and enforcing the regulations. It's regulatory capture. The first line of defense was the Pennsylvania Department of Health. The department's job is to audit hospitals and outpatient medical facilities like Gosnell's to make sure that they follow the rules and provide safe care. The department had contact with the Women's Medical Society, Gosnell's clinic, dating back to 1979 when it first issued approval to open an abortion clinic. It did not conduct another site review until 1989, 10 years later. Numerous violations were already apparent, but Gosnell got a pass when he promised to fix them. Site reviews in 1992 and 1993 also noted various violations, but again failed to ensure that they were corrected. But at least the department had been doing something up to that point, however ineffectual. After 1993, even that pro forma effort came to an end. Not because of administrative ennui, though there had been plenty. Instead, the Pennsylvania Department of Health abruptly decided, for political reasons, to stop inspecting abortion clinics at all. The politics in question were not anti-abortion, but pro. With the change of administration from Governor Casey to Governor Ridge, officials concluded that inspections would be putting a barrier up to women seeking abortion. Better to leave clinics to do as they pleased, even though, as Gosnell proved, this meant both women and babies would pay. This is something I call the Compton car effect, where access is so important that you don't even care if the women are mistreated, injured, or dead. And I'll provide a link to information about the Compton car effect below. The only exception to this live and let die policy was supposed to be for complaints dumped directly on the department's doorstep. Those, at least, would be investigated. Except that there were complaints about Gosnell, repeatedly. Several different attorneys representing women injured by Gosnell contacted the department. A doctor from Children's Hospital of Philadelphia hand-delivered a complaint advising the department that numerous patients he had referred for abortions came back from Gosnell with the same venereal disease. The medical examiner of Delaware County informed the department that Gosnell had performed an illegal abortion on a 14-year-old girl carrying a 30-week-old baby. And the department received official notice that a woman named Karnamaya Mungar had died at Gosnell's hands. Yet not one of these alarm bells, not even Mrs. Mungar's death, prompted the department to look at Gosnell or Women's Medical Society. Only after the raid occurred and the story hit the press did the department choose to act. Suddenly there were no administrative, legal, or policy barriers. Within weeks, an order was issued to close the clinic. And as this grand jury investigation widened, department officials lawyered up, hiring high-priced law firms to represent them at taxpayer expense. Had they spent as much effort on inspection as they did on attorneys, none of this would have happened to begin with. But even this total abdication by the Department of Health might not have been fatal. Another agency with authority in the health field, the Pennsylvania Department of State, could have stopped Gosnell single-handedly. While the Department of Health regulates facilities, the Department of State, through its Board of Medicine, licenses and oversees individual physicians. Like their colleagues at Health, however, the Department of State officials were repeatedly confronted with evidence about Gosnell and repeatedly chose to do nothing. Instead, in many ways, the state had more damning information than anyone else. Almost a decade ago, a former employee of Gosnell presented the Board of Medicine with a complaint that laid out the whole scope of his operation. The unclean, unsterile conditions, the unlicensed workers, the unsupervised sedation, the underage abortion patients, even the overprescribing of pain pills with high resale value on the street. The department assigned an investigator whose investigation consisted primarily of an off-site interview with Gosnell. The investigator never inspected the facility, questioned other employees, or reviewed any records. Department attorneys chose to accept this incomplete investigation and dismissed the complaint as unconfirmed. Shortly thereafter, the department received an even more disturbing report about a woman years before Karnamaya Mangar who died of sepsis after Gosnell perforated her uterus. The woman was 22 years old. It's Shamika Shaw, and I'll link to her story below. A civil suit against Gosnell was settled for almost $1 million, and the insurance company forwarded the information to the department. That report should have been all the confirmation needed for the complaint from the former employee already in the department's possession. Instead, the department attorneys dismissed this complaint too. They concluded that the death was just an inherent risk, not something that should jeopardize a doctor's medical license. And that's that, well, all surgery has risks attitude that the abortion lobby takes. There is nothing so egregious that an abortion clinic can do that the abortion lobby will not dismiss this. Well, all surgery has risks. As if all outpatient surgery centers have flea-infested cats roaming around, crapping on the floors, staff that never even finished high school doping patients up with dangerous narcotics when there's nobody trained in CPR, no crash cart, no equipment for dealing with the emergency. Everybody does that, right? That's their attitude. The same thing happened at least twice more. The department received complaints about lawsuits against Gosnell, but dismissed them as meaningless. A department attorney said there was no pattern of conduct. He never bothered to check a national litigation database, which would have showed that Gosnell paid out damages to at least 5 different women whose internal organs he had punctured during abortions. Again, the missing piece in the pattern was press coverage. Once that began, after the raid, the department attorney quickly managed to secure a license suspension against Gosnell. Similar inaction occurred at the municipal level. The Philadelphia Department of Public Health does not regulate doctors or medical facilities, but is supposed to protect the public's health. Philadelphia Health Department employees regularly visited the Women's Medical Society to retrieve blood samples for testing purposes, but never noticed, or more likely never bothered to report, that anything was amiss. Another employee inspected the clinic in response to a complaint that dead fetuses were being stored in paper bags in the employee's lunch refrigerator. The inspection confirmed numerous violations of protocols for storage and disposal of infectious waste, but no follow-up was ever done, and the violations continued to the end. A health department representative also came to the clinic as part of a citywide vaccination program. She promptly discovered that Gosnell was scamming the program. More importantly, she was the only employee, city or state, who actually tried to do something about the appalling things she saw there. By asking questions and poking around, she was able to file detailed reports identifying many of the most egregious elements of Gosnell's practice. It should have been enough to stop him. But instead, her reports went into a black hole weeks before Karnamaya Mangar walked into Women's Medical Society. Ironically, the doctor at Children's Hospital of Philadelphia, they call it CHOP, who personally complained to the Pennsylvania Department of Health about the spread of venereal diseases from Gosnell's clinic, the doctor who used to refer teenage girls to Gosnell for abortions, became head of the city's health department 2 years ago. But nothing changed in the time leading up to Mrs. Mangar's death. And it wasn't just government agencies that did nothing. The hospital of the University of Pennsylvania and its subsidiary, Penn Presbyterian Medical Center, are in the same neighborhood as Gosnell's office. State law requires hospitals to report complications from abortions. A decade ago, a Gosnell patient died at HUP after a botched abortion, and the hospital apparently filed the necessary report, but the victims kept coming in. At least 3 other Gosnell patients were brought to Penn facilities for emergency surgery. Emergency room personnel said they have treated many others as well. At least one additional woman was hospitalized there after Gosnell had begun a flagrantly illegal abortion of a 29-week-old fetus. Yet, other than that one initial report, Penn could not find a single case in which it complied with its legal duty to alert authorities to the danger, not even when a second woman turned up virtually dead. I mean, not good that it would have done any good to report them, but they still failed in their responsibility. So too with the National Abortion Federation. NAF is an association of abortion providers that upholds the strictest health and legal standards for its members. Actually, they don't. They have in writing the highest standards, but they don't actually enforce them. Gosnell bizarrely applied for admission shortly after Karnamaya Mangar's death. Despite his various efforts to fool her, the evaluator from NAF readily noted that records were not properly kept, risks were not explained, patients were not monitored, equipment was not available, anesthesia was misused. It was the worst abortion clinic she had ever seen. Of course, she rejected Gosnell's application. She just never told anyone in authority about the horrible, dangerous things she had seen. And not only did she fail to report this to the authorities, no action took place within the National Abortion Federation, in spite of the fact that Gosnell was starting illegal third trimester abortions at a member clinic. And member clinics continued to refer women to Gosnell. I don't know why the grand jury report kind of gives NAF a walk on that. The only fault they find is the only fault they find in the intro, and the only fault they actively pursue, is why didn't she report this to the authorities? And we know that that wouldn't have done any good, but at least she should have. But the big thing is that NAF had a duty to publicize this among other abortion facilities, to say, do not refer to this guy. That would have been a bare minimum. Get this guy out of your clinic. Do not let him, don't hand patients over to him. Don't officially hand your own patients off to him, and don't refer patients to him. But they did it anyway, because a dangerous and even fatal abortion evidently is better than an inconvenient one. Bureaucratic inertia is not exactly news. We understand that, but we think this was something more. We think the reason no one acted is because the women in question were poor and of color, because the victims were infants without identities, and because the subject was the political football of abortion.